Hi, my name is Mandy Weister, Associate Director of the Career Development Center at Minnesota State University, Mankato. Over the past several months and years, ASF leadership has had growing concerns over some concerning patterns that have been noticed among ASF members. This survey goes deeper behind the scenes and reveals the invisible reality that ASF members are facing. A survey was administered and all 7 universities participated. Responses were collected from December of 2022 to February of 2023. We had a 59.35% participation rate across the state. This is excellent. Customer satisfaction surveys usually yield 10 to 30%. Employee surveys yield 25 to 60%. And given our population size, the response rate is statistically significant, and the results can be trusted with a 95% confidence level and less than a 3% margin of error. Checkmarket.com sample size calculator was used to find these numbers. We also garnered over 150 written comments. So what did we learn in the survey? We learned that economic increases are not only important, but they are vital to the survival of our ASF members. 89.72% rate a salary increase as very important or extremely important. There is no surprise that this is critically important. It would be to many people in this economy with the current context of inflation, but there's more underlying this number. ASF members are at a particularly unique spot when it comes to facing compression and a lack of cost of living increases over the past 7 to 10 years, maybe longer. I hope you are able to see some other data I'm presenting about the inequity between ASF and other units on campus. This really highlights this concern. But these numbers speak for themselves. 57.57% of members are living paycheck to paycheck. Another 58.6% of our members work one or more side gigs. Their full-time state employee, master's level job quite often does not cut it to afford to live. Significant stress over low balances in their savings and checking accounts. And more than 2 out of 3 members have dipped into savings to pay for food, housing, or childcare. Another portion responded to this question by laughing and saying, "What savings?" Over 66.66% of our respondents are not able to afford food, housing, and childcare on their monthly income. It goes on. People have been making personal sacrifices to get by. 82.28% have given up things that take care of their mind, body, and soul so that they can get by month to month. They've lost hobbies. They've self-sacrificed personal care, simple luxuries. This further exacerbates poor mental health and stress. People have dropped gym memberships. People stretch out the time in between when they get a haircut. People don't do things that used to bring them joy. They don't travel to see families. I had people write in the comments about how we no longer take trips to see our families because we can't afford the gas money. How I have dropped my gym membership. How I no longer take care of my own body in the way I would want to because I need that money for food for my family. This is devastating. 66.38% of our members wait until payday so they have enough money to cover a bill. Another third, 29.54%, have been forced to pay bills late due to their insufficient funds. This is a scary number. 76.92% of our members have considered leaving their position for more money. This means they are actively searching and trying to leave, they have browsed openings, or they are looking. We made some mistakes. We did not ask about participation in social assistance programs for food, housing, childcare, energy, and we should have, because I was surprised when unprompted, many members disclosed anonymously that they themselves rely on food banks to get by, that they have housing assistance or they wouldn't have shelter, that their children are on free and reduced lunches, that they wouldn't have health care if they didn't have a government provided assistance program, that without these government services, without these social assistance programs, their families could not make it. Government employees relying on government programs to get by. This is despicable and so disheartening. This doesn't just happen. There's a context. Federal government cost of living over the last 2 years, in 2022, it was increased by 5.9%. In 2023, that was 8.7%. Let's take a look at what ASF is getting in those years difference. But in fiscal year 23, we got 1.3%. And in fiscal year 22, we got nothing, no base increase, but we got to take one step up, which is equal to 2.66 at the lowest or 3.95 at the highest. Yeah, our steps across our unit aren't equal. So my colleague, we might each get a step, but their step might be a higher percentage than mine. For a system that wants to promote equity 2030, let's talk about equity 2023 among our staff and our faculty. In fiscal year 21, we got 1.5%. And in fiscal year 20, we got one step, again at that 2.66 or 3.95. In fiscal year 19, we got 2.4. In fiscal year 18, we got 1.6. I hope you're noticing the same pattern I am. 1 and 2% cost of living increases when the cost to live is actually going up at a much higher rate. The Minnesota average is $15.95. The daycare average is $14.30 in the metro area for an infant. Our average student loan payment is $254. The average grocery bill is $9.36 to $10.14 for a family of 4. Healthcare $555, taxes $391, average transportation $886, and to live for a family of 3 in 2023 is $60,720. That is a number that 51.34% of ASF employees cannot meet. Over half of our staff could not provide for a family of 3. What about a family of 4? Over 3/4 of our staff could not provide for a family of 4. And that's on the 2022 family of 4 numbers. Minnesota deed defines a typical family in Minnesota as 2 adults, 1 full-time, 1 part-time, and 1 child. So a lot of these averages that you see per month are based on that typical family for Minnesota number. ASF members, if you're watching this, we heard you. Thank you for sharing your stories. I sorted every comment by theme, and you'll see here the general themes that came up. Now, many comments hit many themes, but you get an idea of what's most important. Compression, inflation, and cost of living came in with the highest number of comments. People needing a second job to get by was the next highest. Noticing that other unions on our campus and in our system have more competitive dollars for jobs that are at equal responsibility or even less responsibility. They get paid more. Job searching and leaving, the inability to provide for a family, daycare, medical costs, and income were some of the top ones. And you can see as it goes on, some of the other themes of the comments that came in. What we know about this context, we know that this is not a personal finance budgeting problem. Our salaries have not kept up with inflation and compression, and our people are in crisis. 2 numbers on the screen. The first is $186,399.98. And the second is $275,338.86. What are these two numbers? The first number is the difference between the lowest paid ASF member and the highest paid VP on our campuses. Our VPs make $186,399.98 more than our lowest ASF member. That is a huge range. The $275,338.86, that is the difference between our lowest ASF member and the highest vice chancellor number. I'm not looking at presidents. I'm not looking at provosts at either the state, university level, or at the overall state level system office. This is vice chancellors and vice presidents compared to ASF. So I'm being a little conservative on the high side. This is a huge range. With all due respect, I hope you understand that you might not understand what it's like to try to raise a family and survive in 2023 on our current salaries. I'm going to leave you with a closing thought, and this is coming from a snip of the MnState website, where their core value is articulated. It is the core value of the Minnesota State colleges and universities to provide an opportunity for all Minnesotans to create a better future for themselves, for their families, and for their communities. And I have to ask, have they done that for their employees as well? Thanks.